MD versus DO doesn't matter. I'm Dr. Mo. I'm a DO, first year physical medicine rehab resident. This is probably catered towards a lot of pre-medical students wondering if they should go DO or if they should go MD. And I'm just going to kind of go through the pros and cons of both. So MDs are doctors of allopathic medicine and DOs are doctors of osteopathic medicine. At the end of the day, they both go through 4 years of med school. They both have to go through a residency in whatever specialty you want to go into. And they both pretty much end up practicing, for the most part, like 99% the same. For example, if you take an orthopedic surgeon who's an MD and then you take an orthopedic surgeon who's a DO, chances are, either person can be technically like a better provider just, based on their background and what they went through in a way, based on what residency they went to, whether one residency was better than the other. Or whether one doctor is just like has a better personality and a better persona as the orthopedic surgeon. But based on just them being MD versus DO, it doesn't matter. But now if you're a pre-medical student and you're wondering what like the difference is, if you went to a DO school versus an MD school, basically if you go to an MD school, during your first 2 years of training, basically during your like pre-clinical years, basically where you're just like in lectures, 8 a.m. to 5 p.m. just studying, you're going to be studying only like the body systems and learning just like basically just straight up medicine. Versus if you go to a DO school, you're going to be doing all that exact same stuff, except you also take part, I think it's like 200 hours of osteopathic manipulation. I don't know if it's between the 2 years or if it's like 200 hours in your first year, 200 hours in your second year. But that's like the only difference. I guess there is one more difference. In your third year of med school, DOs, instead of going to, at least at my school, instead of going to a neurology rotation for 1 month, we ended up going to an osteopathic manipulation rotation for a month. So in that way, the training is also a little bit different there. But what was crazy is that 1 month of osteopathic manipulation rotation, for most of my colleagues and for most, I feel like, students at a DO school, that's just like you're on a family medicine rotation where you're attending as a DO and they just like do a little bit of osteopathic manipulation. So let me get into what osteopathic manipulation is also. So DOs go through 200 hours, like I said, of osteopathic manipulation during their first 2 years of med school. This is basically where you're just like in a lab, and think of it like a mixture of chiropractic and massage therapy. Although DOs, at least the ones, the DO teachers, professors, at least the ones at my school, didn't want us calling osteopathic manipulation chiropractic nor massage therapy. But like in my mind, it's basically just like a mixture of the two, and I think it's the best. I think it's better than both. Of course, I'm biased because I'm a DO. So basically that's the only difference between an MD's training and a DO's training, is those 200 hours of osteopathic manipulation in your first 2 years of med school, and then the one rotation that swapped neurology to OMT, osteopathic manipulation, in your third year of med school. Other than that, there is no difference. They also say like DOs are more like body centered or like whole patient centered, which is just like, oh, we take care of the patient and we're not just treating the disease. But I like seeing DOs and MDs practice. We literally practice pretty much the exact same. I don't think like it's too like ingrained in like the schooling that we go to. I think both MDs and DOs try to at least treat the patient, not just the disease. So I don't see any difference when it comes to that. The main difference I do see is just the osteopathic manipulation, of course. So here comes the big part. If you're thinking about going MD versus DO right now, going to an MD school is more competitive. And I don't know if it's for this reason, but MDs typically have higher match rates into more competitive residencies. So say, for example, if you're going into plastic surgery, dermatology, maybe anesthesia, although anesthesia is pretty DO friendly. See, that's what we're calling these things. Like if a specialty is DO friendly, then that's like a term that we use, because some specialties, like I said, plastic surgery, dermatology, orthopedics, these specialties are very radiology. These specialties are very MD centered, and a lot of these places they accept DOs for sure, but the problem is they accept them at a much lower rate than they will accept an MD. I don't know the exact reasoning behind that, whether it's just DO schools are easier to get into, so the applicants that get into those DO schools are just like less competitive just in general. So you might be thinking at this point, well, why the heck would I want to go to a DO school if I get into an MD school? Well, if you are thinking anything primary care, as well as like, there's quite a few other specialties, general surgery, OBGYN, a few of these other specialties as well. They're still very DO friendly. And you would learn osteopathic manipulation if you went to DO school. Now, yes, only like 10% of DOs is, from what I hear, practice osteopathic manipulation. The thing is, out of those 10%, I think it's freaking amazing the results that these people get. And I myself am happy that I went to a DO school. And again, I went to physical medicine rehab, which is fairly DO friendly. So I didn't have really a tough time getting in. And so again, if you're thinking anything primary care or a DO friendly residency, then I think going the DO route is great, especially if you want to use osteopathic manipulation. I've seen OB-GYNs use it. The OB-GYN attending that I worked with as a medical student, he used it on like pregnant patients that had like headaches. He would basically just like do manipulation on their heads, on their like low backs, on their necks, and he would have them feeling better, and they were very grateful for it. And when you're thinking about like these pregnant patients, when they can't be on, a bunch of different medications, even if it is just like an NSAID, ibuprofen or Tylenol, it just like they have a baby inside of them. And hey, if I can treat them with my hands and have them get better that way, then hey, we're gonna do it. And again, they really do appreciate it. And then I've also seen family medicine doctors use it, which family medicine docs, they can basically just like add it on during their visit. So like say, for example, that they're just like seeing a patient for GERD, / acid reflux, for refilling their hypertension medications, for refilling their diabetic medications or some type of diabetic workup, or just, whatever typical preventative family medicine stuff there is. They literally can just include OMT into that same visit. And just like that, they could like add more revenue, especially if they're like productivity based, if they make their salary off productivity and not just like they have a base salary, then they can like really boost the amount of money that they can make. And they also have the patients feeling better. So it's like a twofer. Also, insurances nowadays, I think, again, I'm only a first year resident, so I don't know too much about this yet, but for the most part, I think insurances are now starting to accept a lot of osteopathic manipulation treatments. At least that's how it was when I was a med student and I was doing OMT on patients, throughout my medical rotations. And then I've also seen a physical medicine rehab doctor do osteopathic manipulation. And I also worked directly with a guy who literally went to an osteopathic manipulation residency. So straight out of a DO school, he just went to a 3-year residency in osteopathic manipulation. And that's all he did. He worked at a private practice. He was just charging cash. He ended up like getting a side hustle / a side job at another place, like a pain clinic, where he was charging insurances there. And he was using osteopathic manipulation to wean patients off of opiates. And it was pretty sweet, I will say so myself. So kind of like the big conundrum behind OMT is basically like a lot of people say, oh, OMT, so when I say OMT, I'm talking about osteopathic manipulation therapy. People say that there's not enough research behind it or backing it. And that is true. I recall throughout my medical school training, like my professors in OMT would bring up like some studies, and the studies were like usually just for like back pain, and I think it might have been like headaches, but I think it was mostly just back pain that OMT was actually proven to work. And then elsewhere it's just like case reports, right, of people saying, oh, it helped in this patient, for his arm pain or neck pain or whatever. But there's no like research backing it. And from what I remember, the reason why there's not a lot of research, I could be totally wrong, but I think the reason why there's not a lot of research is because people were kind of saying like it's hard to like have a placebo when you're doing OMT on people. For example, if you're treating someone's neck for headaches or something like that, it's hard to have a placebo. Like you're still putting your hands on them as the placebo. And I don't know, so technically you're treating them in a way just by even putting your hands on them. I don't know. I don't really know how the research works behind that. I never really got too much into it. All I know is that when I do OMT, and I do quite a bit of OMT, it's going to be part of my future practice. I'm going to be doing it quite a bit. I want to become like a master in it. If you get somebody who like really knows how to do OMT, by the way, it is insane how well it works, in my opinion. Regardless of what the research says, it is insane. And I myself, as a student, on my family medicine rotation, I'm trying not to gas up OMT too much and be a DO fanboy, but on my family medicine rotation in medical school, I had MDs. So my family medicine rotation consisted of me being at a family medicine residency. And at that residency, it was like half the providers or residents were DOs and like half of them were MDs. And both the DOs and the MD residents, anytime they thought OMT could help a patient, they literally just brought me in as a medical student and were like, all right, Maurice or Mo, come and do some OMT on this patient. And I remember one of the MDs, like they utilized me a ton. And it was because on like the first patient that she gave me, she was like, okay, this patient has like some back pain. Can you like treat them? I've tried like some NSAIDs. I don't want to give them opiates. You know, they're taking Tylenol already and they still have this pain. And like, go at them, Mo. I'm like, okay, let me do my work. Let me work these hands. And at the end of the visit, I had this lady like standing up. And when the MD came back, I had this lady standing up, giving me a hug, telling me that her pain decreased from a 9 to a 2. And I'm just sitting there going, all I did was use these hands, man. And like, again, you know, it's like, how crazy is that? You know, to have a patient standing up, hugging you, like praising you. Like I felt like the most accomplished medical student in the world at that point in time. So, and that happened on like, I want to say I probably saw like 15 to 20 OMT patients during my rotation there. And it worked on 95% of them. You know, maybe there was like 1 or 2 patients that were like, still the pain's still kind of there. And at that point, I'm just like, okay, well, we can try again later. We can try a different technique later. And they were still happy that I did the OMT on them. They're like, oh yeah, I think it kind of helped, but like I can tell that it probably didn't help that much because they're just like, but it's crazy because it works on like, I think also depends on the person doing it and how into OMT they are. Because I've been to like extra courses on OMT. I'm like pretty serious about doing OMT. So if you get a different person, like a typical DO student, say for example, you went to a DO school because you just couldn't get into an MD school and you're just like, oh, I got to get through these 200 hours of OMT, then yeah, you probably don't want that person doing OMT on you, and they probably don't even want to be doing OMT themselves. But if you get a person who's like very much into it, they, you know, understand that OMT is not like a cure-all, but it's like another thing in your tool belt, then, and they're very much like, you know, happy to do it and knowledgeable in it, I'd say go for it. It's freaking awesome. I think it's awesome. I am very happy I went DO. It's going to be very applicable again to my future practice. I think I'm going to be making more money in my future practice because I'm going to be doing OMT. I think I'm making a lot of patients happy. And yeah, I mean, I've also met a few other PM&R residents that are MDs, or I've met a couple other MD students going into the same specialty I'm in or going into even different specialties saying that they want to do OMT. Which at that point, I'm like, why'd you go to an MD school? But at the same time, also understand because either they didn't know about OMT or they went to an MD school to increase their chances at getting into certain residencies. So it's a double-edged sword. I guess my final recommendations are basically if you want to go to, if you know that you don't want to do OMT and you know that you want to go into like a super specialized field such as dermatology, maybe orthopedics, plastic surgery, you know, like dermatology and plastic surgery, you will probably never need to use osteopathic manipulation. It's just not going to help your patients because they're there for totally different things. So you should probably go to an MD school for sure. Versus if you think you're going to go into primary care and you think you want to use OMT or you want to go into like a specialty where you can actually use OMT quite often, then I say going the DO route is definitely worth it. Yeah, it's just really up to you guys. At the end of the day, you guys will make the decision. I was very in between when I was a pre-med student, deciding between DO and MD. Luckily, I didn't get into any MD schools, so it made things easier for me. And I wanted to be a chiropractor / a physical therapist before I even, you know, wanted to go into medicine in general. And so it was like the perfect combination. So like now I'm doing, you know, manipulation stuff with my hands and I have the whole medicine background. So yeah, I think DOs are pretty like cracked when it comes to treating patients with their hands as well, because I'm not hating on massage therapists or chiropractors. I think what they do is great. You know, I mean, people always have that argument, like, are chiropractors dangerous or are they not dangerous? Are they just like voodoo doctors type of thing? But people also say that about DOs doing osteopathic manipulation. And yeah, I don't really hear too much hate on massage therapy. But what I will say is having a DO who is like knowledgeable in all of medicine, right? They went to med school, they went to residency, they know about, you know, the whole body, you know, multiple different body systems. Whereas if you're a chiropractor or if you're a massage therapist, you don't get that sort of training. I feel like if you were probably a chiropractor, you're probably pretty dang knowledgeable in anatomy and the musculoskeletal system, but you don't know about the other systems. I would assume. I didn't go to chiropractor school, but I would assume that's the case. So for example, if you have, if your gallbladder is infected or inflamed and you have cholecystitis and it's radiating, I think it's to your right shoulder, and you have pain in your right shoulder, and say you come into the chiropractor who's like, oh, I think something's wrong with my right shoulder, but it's actually your gallbladder. The chiropractor might not know that it's actually your gallbladder, and he might just be like, okay, I think it's like some tight muscles in here, let me crack your back. Versus if you went to a DO, they'd be like, oh, you got some right shoulder pain. Oh, but you also have a little bit of abdominal pain right here. Oh, maybe you have cholecystitis. Maybe your gallbladder is inflamed, and maybe you actually need your gallbladder out, and maybe I shouldn't be doing manipulation on your shoulder. So that, to me, is why I think DOs are absolutely cracked if they're both good at OMT and they have some general medicine knowledge. So at the end of the day, again, choose what you guys want to choose. Dr. Mel, I'm out.